right, let's go ahead and get started. Welcome, everyone. Thank you so much for being here for today's webinar, which is about using FSAs and HSAs to pay for physical activity expenses. I'm Dr. Amy Bantham. I will be today's host and moderator. I'm the president of the Physical Activity Alliance and the CEO and founder of Move to Live More. The Physical Activity Alliance is pleased to host today's webinar. The Physical Activity Alliance is the nation's leading coalition of organizations dedicated to promoting health and well-being through physical activity. I am joined today by a wonderful panel of experts, and I'd like to invite our experts to introduce themselves. Amy, can I have you start?
Sure. My name's Amy Way. I'm a senior counsel in the IRS Office of Associate Chief Counsel, Income Tax and Accounting. And my office has jurisdiction over Section 213, which we're going to discuss, which is the medical expense deduction. So thanks for having us today.
Great. Thank you so much for being here, Amy. How about you, Kevin? Would you introduce
Hi,
yourself?
my name is Kevin Knupp. I'm a senior technician reviewer in the HW Health and Welfare branch of the Office of Chief Counsel of the IRS. And I have worked on the cafeteria plan regulations, which are the regulations for flexible spending arrangements, as well as the rules for HSAs, pretty much since the most recent versions have been out there.
Great. And Dr. Liz Joy. Liz, I'll move to you.
Yeah, good morning. I'm Liz Joy. I am a physician and chief medical officer at Lower Health, and I am the current chair of the healthcare sector for the National Physical Activity Plan, as well as the American College of Sports Medicine's Exercises Medicine program.
Great. Thanks, Liz. And Dr. Lori Witzel. Lori?
Thanks, Amy. It's a pleasure to be here this afternoon. I'm Lori Witzel. I'm National Vice President of Policy Research for the American Heart Association and Senior Advisor to the Physical Activity Alliance.
Thanks, Lori. And Mike?
Hi, everyone. I'm Mike Goscinski. I'm the Vice President of Government Affairs at IRSA, the Health and Fitness Association, and I am our Chief Government Affairs Officer, and I'm happy to be here today.
Great. Thanks so much, Mike. And Theresa?
Hi, I am happy to be here as well. My name is Theresa Adams, and I work at SHRM, which is the Society for Human Resource Management, and I'm a senior advisor in the HR Knowledge Center, where we assist our members with HR-related questions.
Wonderful. So as you see, we have a wonderful panel, and we also have a wonderful audience. We had over 300 registrants. We have employers who are thinking about how this impacts their employees. We have healthcare providers thinking about how this impacts their patients. We have health and fitness centers thinking about how this impacts their members. And we have individuals thinking about how this impacts themselves and their families. So let's go ahead and get started. Amy and Kevin, my first question is for you all. If you could level set us and really help us understand the IRS guidance on this. I know, Amy, you said you're really the expert on Section 213. Kevin, I know you're the expert on Publication 502. If you could really walk us through what we're talking about when we're talking about using these tax-favored accounts for physical activity expenses, what expenses are covered, what expenses are not covered. So walk us through the basics here.
Sure. Go ahead, Kevin.
Maybe I'll start, because I will talk about the framework of FSAs and HSAs and how and why the 213D definition of what is medical expenses is so important. I'm actually not an expert on 502, which is the medical expense publication. That would be Amy again. But just by general background, the statutory authority for the exclusion of FSA reimbursements, which is when you get reimbursed by your FSA, the amount is not included in your income, even though it's being paid by your employer. The authority for that is Section 105B of the Code, the Internal Revenue Code. And 105B of the Code is specifically limited to reimbursements of 213D medical expenses. Similarly, for health savings accounts under Section 223 of the Internal Revenue Code, it directly ties into what is a medical expense under Section 213D, which Amy will tell you about shortly, and why that's important that these things be medical expenses under 213D in order to be reimbursed. But that's why it's important that they be under 213D if you want to be reimbursed by an FSA, an HRA, which is sort of an FSA that's solely funded by your employer, or an HSA. The regulations for underneath 125 of the code, which is the cafeteria plans, are at 1.125-6, and those regulations require that an FSA reimbursement be substantiated. An FSA substantiation for reimbursement requires third-party information, so you can't do this by yourself. You can't sort of write it up on your own. It has to be from someone other than you, such as the provider who you're paying for the service, and they have to sort of provide a description of the service or product from the third party, the date of the service, and the amount of the service. Now, if a service is not obviously a medical expense, such as general expenses, which may or may not be medical, you're going to want to, best practices are going to include some sort of documentation of why that expense is a medical expense, and that sort of thing would need to be included before the plan of reimbursement. In the case of an HSA, individuals need to keep their own records. If the IRS comes to examine them and says, well, you took this money out of your HSA for this expense, show us why that expense was a medical expense. Again, you'd want to have that third-party information to show why this particular item was a medical expense. And now I'll turn it over to Amy to talk about how you show that a particular expense is a 213D medical expense.
Thanks, Kevin. I just want to throw out a few disclaimers for Kevin and I. We're both speaking in our personal capacity, not on behalf of our agency, so our views are our own, right? And I can't really answer specific questions, but we can give you what we're going to talk about are general rules to apply in determining whether or not something's medical care. I also wanted to say that Kevin and I aren't medical professionals, we're tax attorneys. And what our office does is we interpret and administer the tax law. So any changes to the law must be made by Congress. So just having that out there. So references to Section 213 refer to Title 26 of the United States Code, and Section 213 was enacted in 1942. And what it provides is an expense is allowed as a deduction if it's paid during the taxable year, not compensated for by insurance or otherwise, for medical care paid for the taxpayer, spouse, or dependent to the extent that the expenses exceed 7.5% of your adjusted gross income. The statute also provides a definition for what is medical care, and as relevant here, there's a couple prongs, but what's relevant here is that the amounts must be paid for the diagnosis, cure, mitigation, treatment, or prevention of disease, or for the purpose of affecting any structure or function of the body. So under the tax law or under the law, personal, family, and living expenses are not allowed as deductions. So we need to distinguish, what is personal and what is medical. And the medical expense deduction is a very narrow exception here. The Treasury regulations, which their purpose is to help to interpret the law, add some more rules to distinguish between medical and personal. And our regulations provide that deductions are confined strictly to expenses incurred primarily for the prevention or alleviation of a physical or mental defect or illness. So in other words, the primary purpose must be for medical care. And we can look at the intent of the individual who's getting the medical care, but it is a question of fact, meaning that, one person's situation may be different than another person's. It could be medical care for one person and not medical care for another. So it's not something that we can just, plus, oh, of course, this is medical care. Also, the regulations provide that expenses merely beneficial to the general health of an individual is not paid for medical care. So here again, personal expenses not allowed. And, while the IRS appreciates the benefit of regular exercise, the law as interpreted treats them as, treats such things as gym memberships as personal expenses because they are for general health. The determination of what is medical care, there's a couple rules through court cases which also help distinguish between what is personal and what is medical. And one of the first steps is that, there needs to be some sort of disease. And the way that the court cases talk about it, there has to be a present existence or imminent probability of developing the disease. Other factors we can look at are the taxpayer's motive and purpose, the origin of the expense, the doctor's recommendation. Did the treatment bear directly on the effectiveness of the, bear directly on the physical condition, basically looking at the effectiveness. or was the treatment proximate in time to the onset or the reoccurrence of the disease? Another thing that, another analysis that we use is called the but-for test. The individual would not have incurred the expense but for the disease. So it requires the individual to prove both that the expenditures were an essential element of the treatment and they would not have otherwise been incurred for non-medical reasons. So I realize that's a lot of legal analysis, and what do we really need to know here? The Physical Activity Alliance gave us a couple questions, and I thought it might be better to just respond to those to help illustrate this. The first question was, what physical activity expenses are considered medical expenses under Section 213? And again, we go back to, it's very specific to an individual, so you need to look at the facts. But in general, you would need a diagnosis of a disease by a physician. The exercise or the physical activity must be used to treat the disease, and we'll look at the effectiveness of the treatment. Also, the individual would not have incurred the expenses but for the disease. So that's the but-for test. And there actually are a couple court cases that look at whether or not a physical activity is a medical care expense. And one that I thought would be helpful in this explaining this was this one case called Cherry. And the individual suffered from severe emphysema and bronchitis. And the doctor recommended swimming because the individual tried jogging and bike riding, but found that it placed too much strain on his body. However, swimming increased his breathing capacity if he did it regularly. And if he didn't swim, he noticed he would start having a shortness of breath and wheezing after 4 or 5 days. So in that case, the court found that there was a direct relationship between the exercise treatment and the disease and allowed it as medical care. So it has to be more than just beneficial. There needs to be some sort of direct relationship between the exercise treatment and the disease. For some reason, there's a lot of cases dealing with dancing lessons. And the courts have found that, although it's beneficial to someone, for someone to exercise, it doesn't quite cross the line to medical care. There is some IRS guidance out there that came out around 2000 regarding weight loss reduction programs. And the example or the scenario that was presented was a taxpayer who was diagnosed by their physician as obese. And in the IRS guidance, it stated that obesity is a disease. And at the physician's suggestion was to lose weight. And because the treatment of the weight loss reduction treated the obesity, it was allowed as a medical care. The amount paid for the weight loss reduction program was treated as a medical care expense. We were also asked about how does this work in timing with regard to annual memberships. So for the medical expense deduction, generally it's in the year paid as long as it all occurs within, by the end of your taxable year, which is December 31st for most people. Otherwise, it should be prorated. So if you start a membership in October and it goes into the next year, you would be able to take October, November, December this year, and then the rest would be in the following year for your deduction. And Kevin, does it work the same way for the health savings arrangements? And you're on mute.
Yes, more or less.
Okay, great. Okay, and the next question dealt with physical activity expenses that were previously used for general health. And I think, the gym membership is probably very typical that most people have gym memberships, and those are usually considered personal expenses because they're for general health and well-being. And if it was a personal expense prior to the diagnosis does not turn it all of a sudden into a medical care expense. Still for general health and well-being, it's kind of the but-for test, would you have incurred it otherwise? And, having a diagnosis doesn't, I think it would be difficult to prove at that point that it would treat a specific disease. So I don't see that. There actually is a court case I'm thinking about. There was an individual and he belonged to a golf club. And he liked to golf, and then he was diagnosed with pulmonary emphysema. And the doctor told him he needed to walk more. And he tried to deduct as the transportation to his golf club as medical care expenses. And the court said, no, it was a personal expense before, it's still a personal expense. Even though you walk at your golf club, it's, it doesn't change it all of a sudden into a medical care expense. The The last question we have is expenses for a condition that might stop being eligible. And the example that was given was an individual who has obesity, and then after a couple of months, their BMI lowers to, a level where they're no longer considered obese. And how would you treat that? And in that case, it would be, it's no longer considered medical care. So at least for the medical expense deduction, you would have to prorate it, prorate the expense. Kevin, do you have anything to say about that for FSAs and HSAs?
No, generally, I think you're limited to the amount for the year. You can't sort of defer benefits to a later year.
Okay. But at this point, I think that's the end of our presentation. I just want to say that our agency does welcome comments. Every year, usually in the spring, our office specifically solicits comments that the public would like to see guidance on. Even if you missed that notice, we always welcome, we like to hear what questions are out there, what issues are out there. So please feel free to contact us. Thanks for having us.
Thank you, Amy and Kevin. There was a lot there. So grateful to you for going through those various scenarios, because I think that helps people understand the guidance in less of the legalese and more real world scenarios. Dr. Joy, I want to turn to you. We've talked a lot about medical care, and I'd love to understand from your perspective how you see a physician like yourself using this benefit to help patients with certain conditions and diagnoses get more physically active. I'd love for you to walk us through the process of writing a letter of medical necessity, which seems to be a clear piece of this. So I'll turn it over to you.
All right, thanks, Amy. And thanks to Amy and Kevin as well for some clarifications around, what is perceived by most of us as incredibly complicated, anything that has to do with the IRS. As it relates to, the people getting reimbursed through health savings accounts, and I'll probably limit most of my comments to that. They have become, very increasingly accepted and adopted by U.S. adults who have employer-based health insurance, right? So health savings accounts pretty much only exist if you have employer-based health insurance, and certainly not everyone has that. But about 1 in 5 Americans report having a household health savings account or a health-related flexible spending account. And I read recently that an average balance is around $4,600 per household, which seems like a lot of money, except if you're using that to pay for doctor's visits and medications for chronic care, toss in a few urgent care or emergency room visits, and that money disappears rather quickly. But I think being able to access these funds to pay for physician prescribed, physical activity opportunities is a good thing. And I'm going to come back to that. I think I heard the term gym memberships, but, that's only one way that people, access, commercial fitness activities. And I do think it's really important for everyone, on the webinar today to realize that, income gaps, become physical activity gaps. And there was a New York Times article earlier this year that said the income gap is becoming a physical activity divide. And we know this is particularly true for kids because children from less affluent households are less likely to participate in sports and to achieve regular physical activity. And maybe we'll come back to this in the second round of questions, but I think dependents can be eligible for this benefit as well. So, like to hear some clarity from Kevin and Amy about how, whether it's deductions or health savings account money, if that can also be used to support access to physical activity resources for kids who have medical needs. And of course, Amy, this area of kind of physical activity for, underserved populations is definitely something I know that you have some expertise in. And those populations have most definitely identified financial constraints as a barrier to physical activity. Now, Amy said she's not a healthcare provider, and I'll say I'm not an attorney. But, in some of the information I read, the 213 code states that, and I quote, the cost of a gym membership as a medical expense that can be paid by an HSA, FSA, Archer, MSA, or HRA if the membership was purchased for the sole purpose of treating a specific disease diagnosed by a physician, such as obesity, hypertension, or heart disease. And I quote, as a family physician who sees, a range of patients, across the age spectrum, many of whom, maybe even most of whom, have chronic disease, let me just share some statistics with the group. It's 1 in 3 US adults have prediabetes, between 50 and 70% of whom will go on to develop type 2 diabetes within 10 years. 48% of US adults have hypertension, and heart disease remains the #1 killer of US adults. 42% have obesity, nearly 20% have clinical depression, and nearly 60% of adult Americans have at least one chronic disease. So, to me, it would imply that a majority of US adults, those with a health-related savings account, or, who would consider, a deduction, would qualify for some form of reimbursement or deduction. So that's a lot of people who would be eligible, for physician prescribed gym memberships. And let me just carry on, Amy, we had talked previously about, what conditions, could be treated with physical activity. And then I'll get to this idea of writing a letter of medical necessity. But, aside from those conditions that are mentioned specifically in the rule, which were, obesity, hypertension, and heart disease, there's so many others, that have their roots in unhealthy lifestyle behaviors and physical inactivity in particular. And we have, incredibly decades-long evidence base to show that regular physical activity impacts the outcomes for people with heart disease, chronic obstructive pulmonary disease, osteoarthritis, depression and anxiety, cognitive decline, recovery from cancer, and even more. So again, there are very few adults, unfortunately, who probably, wouldn't qualify, for accessing a health-related savings account, or exploring whether or not their expenses meet the deduction rule as it relates to physical activity. Let me talk a little bit now about the letter of medical necessity. And, personally, I've never written one, for access to physical activity resources, because I think for many of us on the call today, while this has been in, there's been some awareness, that goes back to March of this year, which is when I first started to see this. We haven't had, an implementation strategy within the healthcare system for physicians to do this on a regular basis. But I do know what needs to be included in a letter of medical necessity. And oftentimes, depending on who the payer is that or organization that manages your health savings account, there may actually be a form for the prescriber to complete, which actually guides them through the information that is required that Amy referenced in her remarks. Obviously, it has to include the patient's name, a specific diagnosis, along with recommended treatment. So for example, a recommended exercise program, through accessing a physical activity resource for the next however long, 6 months, 12 months, will address these components of a person's disease state. It needs to include the duration of treatment. And I believe that these letters of medical necessity, and again, I'll ask for clarification from Amy and Kevin, but I believe the letter of medical necessity is valid for 1 year from the date it is written. So it's not just for the calendar year, but it's from the date it is written. And if the treatment extends beyond that time period, then the member or the patient needs to submit a new letter of medical necessity covering the next time period. Obviously, it needs to be signed by a licensed medical provider. It should be on letterhead or on a provided form. So that's kind of what I know about the letter of medical necessities. Like I said, I've written these for accessing other resources. And maybe before I turn it back to you, Amy, I do want to just make one comment just in regard to something that Amy shared. And that is if the person was participating in or they had a gym membership before they received a prescription from a provider. So, you know, there's kind of like this assumption that all physical activity is just physical activity, right? And yet, you know, we may prescribe different types of physical activity depending on what that patient needs. So, for example, you know, somebody who maybe has a gym membership for general health, but now they come to see me, and what they're experiencing is, you know, more osteoarthritis or worsening of osteoarthritis symptoms, or now they are symptomatic with their osteoarthritis. And as such, they've had a number of falls, and falls have resulted in urgent care and emergency room visits. Maybe they even sustained a fracture that required surgical intervention. Now I want them to have a different type of physical activity intervention. I want them to do a fall prevention program, you know, that is specific to their underlying condition. So again, it would be great to get some clarification is if we modify the type of physical activity that we're prescribing, even if they were previously doing something else, you know, would that meet the definition of a new prescription that would allow people to access their HSA or health-related FSA funding. So I'll pause there for now.
Thanks, Liz. And Amy and Kevin, I'll get you back in once we've been able to first hear from Theresa and then Mike and Lori. We have questions coming in from the audience. Keep the questions coming. And Theresa, let's enter the employer realm. How can employers interact with their FSA, HSA administrators? How can they communicate to their employees about this benefit? How is it being done in practice? Help us understand this a little bit more.
Absolutely. Well, one of the questions I had is, are employers encouraging their employees to take advantage of this? And I'd say from a broader perspective, certainly employers and employees are always interested in improved health and well-being for multiple reasons. The benefits are obvious: improved productivity from an employer standpoint. You know, there's just so many benefits of physical activity that I think certainly employers are encouraging that, and even more so since the pandemic. You know, I think it's been brought to light much more. Unfortunately, I don't think that a lot of HR professionals are aware of this. I personally had not heard of it initially. So, and I work, you know, in the Knowledge Center where SHRM has 325,000 members. We get questions daily from HR practitioners. And unfortunately, we have not had members asking questions about this. So I think there's a great opportunity to educate employers on this. And I think it's a win-win for both employers and employees. I was kind of focusing on gym memberships, but certainly this could apply for all physical activities. But in terms of gym membership, this has long been a part of employee wellness strategies and programs, you know, where employers are reimbursing employees or subsidizing those exercise activities. Of course, in that scenario, correct me if I'm wrong, Amy, but in that scenario, the value of that subsidy would be considered taxable income to an employee. So obviously the difference in this situation is it creates a tax advantage to employees when they're using the those medical savings accounts like FSAs and HSAs to get reimbursed for those memberships. Certainly, this is only going to apply to a certain population within the workforce, those that have a medical necessity for it. But I think it certainly would be wise to educate employers about this and get the word out so that encouraging can happen. In terms of improving the uptake of that, obviously getting the word out to industry vendors, third-party administrators for these medical savings accounts and employers is the first step to improving that. And, you know, just simply educating that this is a medical expense that's now acceptable under the IRS guidelines if a doctor indicates that there's a medical necessity. Another way to increase uptake is to participate in HR conferences as speakers, or even go to local chapters. For example, SHRM has multiple chapters within each states where HR professionals meet usually on a monthly basis. They're always looking for speakers to come out, and it would be a good way to present that information to those people that are directly involved in setting up those types of programs. And again, the key is to focus on the tax advantage for the employee on this. Definitely providing persuasive talking points and so on is critical. You know, and just to give you an idea, from a SHRM 2019 benefit survey, I think there was 33% of employers subsidize or reimburse gym membership currently, even without this benefit. And another thing that I found really interesting, a study from the National Business Group on Health predicts that 66% of employers will be offering FSAs to their employees in 2023. So that's huge. That's a huge number. If you add in the HSAs and the HRAs, that number increases. So there certainly is a lot of funds available to use for these physical activities. And the study predicts that that number is only going to continue to grow as employers and employees are looking for ways to save money to help with those healthcare costs. So I think there's a great opportunity there. Another question was about how do employers communicate with employees about using these benefits? Certainly the most common is to provide information during the open enrollment periods where they're enrolling for these medical savings accounts. But it shouldn't just start there. It should start at the orientation and onboarding process, educating new employees on this benefit. And providing information to employees in a range of formats and languages that meet employees' needs is important. Communication on a frequent and ongoing basis throughout the year is important, not for any benefit that an employer is offering. So certainly starting at that onboarding and an open enrollment process, but also keep that communication going throughout the year. For example, at company meetings or on the company intranet site and so on. Continue to communicate about this physical activity benefit that employees can take advantage of. You know, if it's not front and center of the employees' minds, unfortunately, they often forget the benefits that they have. So the more employers can talk about it with employees and get it in front of employees, I think, you'll get much more of an uptake. Other things that employers can do are offer lunch and learns like FAQ sessions about this topic, or offered times where employees can meet privately with a representative to discuss it. The more comfortable they are with it, the more likely that they're going to use it. In terms of working with the administrators, from an employer's perspective, they'll want to ensure that those administrators have a compliant process to substantiate those claims and, develop a process to introduce and substantiate those claims. So for example, the letter of medical necessity, create a form for employees to use, provide directions on how to get reimbursed for that. Keep in mind the oddball things that will come up, such as some if in the case of gym memberships, you're paying some gyms require the full year up front for payment. How does that get reimbursed through the third-party administrator? So I think there's just really a lot of opportunity for this. The word just needs to get put out there.
Great. Thank you, Theresa. I appreciate your quantifying the scope and the opportunity there. Mike, I want to turn to you. There have been a couple mentions of health club memberships, and I'd love to hear your perspective on how using FSAs, HSAs for physical activity expenses impacts the health and fitness industry, and any concerns or risks about how this might work in practice. This section is very much about how this works in practice.
Certainly. First, I, of course, want to thank the panelists for joining and providing insights today. I know our members are always strive to serve their customers in the best way possible, and making sure that any ways to increase physical activity and affordability to physical activity is certainly front of mind as we move ahead. For our members, it's always about the consumer. The fitness facilities in the United States want to make sure that they are provided with accurate information and understand what is available to them to increase affordability and access. So this is a great first step. I appreciate, again, the representatives from the Internal Revenue Service jumping on here to clarify what it means for consumers. And I know that, as we're working, we all share the understanding that physical activity has great benefits on physical and mental health. The guidance is a great step in that recognition, and the utilization of the health and fitness industry as a necessary part of the medical care system. Our goal, of course, as always, is for physical activity and its benefits on physical and mental health to be treated as preventative health care. And I think that's something the industry continues to strive to do, and strives to get the point across to legislators, policymakers, and the medical community, the benefits and what that means on the average American to have increased access to utilization of the industry of physical activity. As you've mentioned, and I know as many on the call know, we are working on legislation to take it a step beyond this first step of the initial guidance for medical care treatment, to pass legislation that would allow every American with access to an HSA or an FSA to use their pre-tax dollars on physical activity and youth sports expenses, knowing and understanding full well that the youngest Americans are losing access to physical activity, whether that's through the school systems. Youth sports participation rates are decreasing consistently, and that poses a long-term health risk to individuals throughout the country. So as I mentioned, we are working on the FIT Act, and it's the Personal Health Investment Today Act. And through our research, just reiterating the points that Theresa made from SHRM, is that we know that when polled, nearly 9 in 10 Americans agree that Congress should be allowing these pre-tax dollars to go towards gym memberships and youth sports. So it's exciting to see this personal step, but where our concerns lie, and I just want to raise for the group, and maybe anybody can chime in if they can, our concern always is protecting the fitness facility and the operators that operate our fitness facilities, ensuring that those that have been assessed and prescribed physical activity as part of a medical care are not only fully complying with the guidance, but also that the abuses of these new guidance doesn't shine a negative light on the industry and the incredible work that we're all doing to increase physical activity and to increase increase access to physical activity through bills like the FIT Act or other ways we're working with policymakers to ensure that all Americans have affordable access. And that we are not necessarily shining a negative light on where we stand as an industry based off of abuses that may be out there or that may be used of the guidance. And I'll just leave it there, and happy to chime in as we continue discussion.
Great. Thanks so much, Mike. Dr. Whistle, I want to turn to you. Mike mentioned affordability and accessibility. And this is very much in keeping with the mission and vision of the Physical Activity Alliance, our It's Time to Move campaign. And so I'd love to hear from you how you see this really expanding access to physical activity.
Thanks, Amy. So let me just take a little bit of time to talk about our It's Time to Move initiative. It's a multi-year, multi-pronged effort building on the great work of Liz in the healthcare sector, the National Physical Activity Plan, exercises medicine, all the work that's been talked about today so far. We're building on that to do national policy and systems change that support the integration of physical activity assessment, prescription, and referral into healthcare delivery. We want to help people on their journey toward active living, and we want to create the opportunities within the patient and clinical workflow, connect health systems to community-based organizations and patients, supporting patients who need the help and support to be more physically active for their health and well-being. So we've been working this past year on just some foundational stuff, building standardized measures into the electronic health records to enable clinicians to have the conversation with patients. We've done that work. We've got an implementation guide for physical activity, standardized measures that's now out in the public domain for any health system to integrate into their workflow, for the EHR vendors to do that, and digital health technology, et cetera. So we're excited to shift toward implementation and work toward that uptake of those standardized measures. We also work with the Office of the National Coordinator, so another key agency in the federal government, and we worked with the Office of the National Coordinator to get physical activity assessment into the US core data for interoperability standards. So in a couple of years, when this is fully implemented, physical activity assessment would essentially be required in all EHRs across the country. So those are foundational steps, but now we've got to move to some of the other prongs of our multi-year, multi-pronged plan, working on the coverage for physical activity prescription. And Amy and Kevin, this is why we're so grateful that this is one piece of helping people have the financial support to follow through on an exercise prescription. But we'll be working, continuing our work. We contracted with Avalier to build out a strategic roadmap to engage the payer community and try to find other ways to pay for the exercise prescription for those who need that support and help. So we'll be working in that space. We'll be working also on quality and performance measures to incentivize clinicians, health systems, and payers to make this part of standard of care. So lots of work to go. It's been quite a journey so far, and we're looking forward to continuing that journey. And I'm excited that this is one piece of the total picture that we're trying to accomplish. And just really grateful for the panel today. I've learned so much just listening to the conversation, and looking forward to continuing this discussion and learning more.
Great. Thank you all so much, panelists, for our first round of questions. We have questions coming in from the audience that I want to make sure that we get to. There are a couple around clarification of guidance. And Amy and Kevin, I'm not sure how you want to handle tag teaming again, but there is a question about prevention. We talked a lot about treatment of conditions, but the question is, given the guidance is prevention or alleviation, when does prevention qualify? And for example, if I wanted to use my fitness membership to prevent obesity, for example, what is required? And maybe speak to prevention largely, Rit.
Right. So we get this question pretty often. The problem with using prevention as your of disease as your, reason why you're seeking medical care is that prevention is often looks like general health and well-being. So, you're preventing obesity by going to for example, you're preventing obesity by going to the gym, but also you're there for your general health and well-being to maintain where you are. It's very difficult to draw that line. And unfortunately, we don't have much guidance out there as to what actually qualifies as prevention of disease. There's only one case out there, or actually one piece of guidance out there that we actually talk about prevention of disease, and it's with regard to like lead-based paint. And basically it required the individual to actually have lead poisoning in order have the expense qualify as prevention of that disease. And it's just, it's really difficult to address or to meet that standard. That might be an area where, we would welcome comments from the industry to, at least hear your thoughts on that piece.
Kevin, do you want to add? Or are you good?
I have nothing to add about that. I know that earlier a question came up about, can you use FSA money for your children? Can you use HSA money for your children? And the answer would be generally yes. For an FSA, it always depends on the terms of the plan. They can decide who's covered. Generally, however, under 105B, which is the authority for FSAs, the exclusion includes both, the employee's spouse, and the employee's dependents and children until they reach age, I believe, 26. And it's similar for HSAs. HSAs can cover both you, the HSA owner, the HSA owner's spouse, and the HSA owner's dependents. So it can cover children who are dependents.
Great, thank you. Does anyone else on the panel want to weigh in on the issue of prevention? First, I'll take prevention, then I'll move to kids. Anyone wanting to weigh in on prevention? No? Liz.
Well, this is a little tangential to prevention, but I just, I think many people on the call, are thinking, especially since the rules specifically say that it can't pay for dance lessons. So that gets a little tricky. What about somebody who's doing Zumba, right? I mean, it's an evidence-based fitness activity, which is through dance. And maybe that would be considered a dance lesson. Maybe it would be considered a fitness activity. And it's definitely consistent with the physical activity guidelines for Americans, which come out of the Department of Health and Human Services, around our guidance to people to move your way, right? And, when we think about, it kind of references back to my comments about, when people have different conditions, we may prescribe different types of activities. The same way when somebody has a different medical condition or their medical condition evolves, we might prescribe different medications, maybe within the same class, and they're still generally covered by their insurance. So anyways, I just, think that can be obviously from both a prevention perspective and from a treatment perspective, but I wanted to make sure I said that.
Great. Amy, do you want to respond? And then Mike, I'll go to you.
Right. So I don't remember exactly how it's worded, but, as I stated before, every individual is different. And we understand that different treatments, may work for some people and others, and some may not work for others. So, I mean, I think saying there's an overall ban on dancing lessons is not accurate. I think we need to look at the individual, their specific diagnosis, the treatment plan that's prescribed to them by their physician to make that determination.
Great. Thanks, Amy. Mike?
Yeah, no, I just wanted to thank Liz for raising that point, because it is, and we know that prevention starts for the youth of the country as well. Prevention, as we've mentioned and we've talked about, could look in many different ways, right? And if we want to prevent obesity, you should start moving at a young age. You should stay physically active. We know that the President's Council on Physical or Sports and Nutrition and Fitness has talked about dancing as a part of working that into their work this year. And I think that it's just a great point and a great opportunity to reiterate that while this guidance is great for the overall public and understanding the power that physical activity has, it is not the end all be all if we're looking to make that change. And make sure that we are looking at physical activity as a preventative health measure. And that's why the work that Lori talked about as well is so vital and so important, because this is a great step in that direction.
Great, thank you all. So I have a question for you, Dr. Joy. A little bit of guidance about how people covered by one of these tax advantage accounts might talk to their physician about the letter of medical necessity or getting a physical activity prescription explicitly for the disease being treated. My physician tells me to exercise more and eat healthier, but there's not really that conversation to document a medical need. So maybe a little bit of guidance around that precursor to the letter of medical necessity.
Okay, wow, that's a loaded question. And I have to start with just the concept of benefit literacy. And, Theresa can weigh in on this too, because it doesn't matter if you're the CEO of the company, or if you are a frontline worker. Turns out that benefit literacy it's not significantly different, right? And so people often don't understand their benefits, let alone whether or not there's an IRS regulation around a letter of medical necessity that can help them access HSA funds for accessing physical activity resources. I mean, that is such a fundamental problem, in the payer industry, that is like the first barrier. And I have spoken about this at length, in other settings. So that's definitely a underlying challenge here. But let's say that somebody does, in fact, they hear about this. Maybe they see something on Facebook, because that's where we learn everything. So they learn about it on Facebook, and they go to their next primary care appointment, and they say, hey, I understand I can get a letter of medical necessity that allows me to use my health savings account for a gym membership. Can you help me with that? Well, I'm gonna guess that 9.9 out of 10 physicians know nothing about this as it relates to accessing physical activity resources. Definitely, they have written letters of medical necessity for other things, whether it's a piece of durable medical equipment for somebody. The one I write the most is for shoes for people with diabetes. And but they've definitely written these letters before. They probably know what the components of that letter is. And most often, if that person shows up with a form and says, can you please fill this out for me? They're going to fill out the form and then turn it in to whoever it is that is managing their health savings account. And that's probably how it's going to happen at the point of care. One of the questions that I have, and I'm not sure if who's the best person to answer this, but since this is new and there is nuance, and there's even some what I found to be some contradictions within the rules, when this is being adjudicated, how long does that take? Is this something that people can expect to hear back in 72 hours, a week, a month, 3 months? But as this becomes more well known and people are seeking either access to their HSAs or using it as a deduction, that seems a little bit less likely. But nonetheless, I'm curious about the timeline for adjudication.
Well, I would note that, HSAs are largely can be self-administered. You can take money out of your HSA whenever you want, and then you sort of true things up when you complete your 1040. There's a form that says what were my medical expenses and what were my HSA withdrawals. So once you have the form, presumably with an HSA, you could go ahead and take the money out, and then when it and just make sure you file that form away so that if you're ever examined, you can show that yes, I spent this money on this exercise activity, but here's my form that said I needed it to treat this specific disease for which it was necessary. With FSAs, on the other hand, it's going to depend. It's going to vary from plan to plan in terms of what their substantiation rules are and how they manage those things. I mean, and that's going to vary. It's really very plan dependent.
Great.
And I'll just chime in for a moment, excuse me.
Please.
And I would say that I think in my experience, this has been around for quite a while, these health savings, medical savings accounts, whether it's FSA, HSA. And I think there's a really good system in place to get claims processed. So as long as there is a process in place and the appropriate documentation is submitted to the administrator, there's usually a pretty quick turnaround time, especially using those debit cards. That speeds up the process so much to get claims reimbursed. So I think from an administering claims for that, I think it's a pretty quick turnaround time as long as everything's in place.
Great,
I
thank you,
would
Theresa. Go
suggest
ahead,
that
Kevin.
it could be problematic with debit cards. Debit cards, you're going to have some sort of a merchant category code that matches up to medical expense. And I don't know that most exercise expenses are going to automatically do that. So you're probably going to have to do something other than debit cards with respect to these sort of expenses, which aren't medical expenses on their face.
Okay,
Just
thank you.
Yeah,
that's my reaction.
Yeah, well, you're the expert on that. How could we overcome that? If they've already got a contract, say, for example, the administrator has a contract that shows, what the employee's paying, or you're saying just in general debit, there is not a code for that specifically, so that's going to hinder it.
I don't think you could. I just don't think a debit card is the avenue for reimbursing these expenses.
Okay.
You're going to have to, submit a request to be reimbursed, and then get your check from the plan.
Mm-hmm.
Thank you, Kevin. Thank you, Theresa.
You're
We
welcome.
are very close to being out of time, but I do have a number of questions coming in about mental health. There have been a lot of focus on physical health diagnoses and obesity, diabetes, etc. that would qualify, but what about mental health diagnoses? Amy or Kevin, do you want to weigh in on that?
Whether or
they
not
do,
mental
maybe I
health
would
is
just
considered a disease?
No, just in terms of the guidance tends to list physical diagnoses exclusively.
Oh, mental health is, a disease. I mean, there can be mental health. I know I'm not saying this correctly, but there are cases out there where, courts have said, this mental health issue is a disease. Is that what you're asking? I guess.
Yeah, I wanted you to get the legal piece and then Liz, of
Oh.
course, the medical piece.
I was gonna say, there's this huge systematic review and evidence base around the efficacy of
Oh.
physical activity for mental health, especially depression and anxiety. But Liz should be the one answering that, but that's why Amy and Kevin, it's really great to have confirmation that could also be considered a qualified medical necessity.
All right, Liz, do you want to weigh? We only have about a minute. Do you want to weigh in at all about mental health and physical activity?
Well, just to reiterate Lori's point, there is an incredibly strong evidence base showing that regular physical activity can help to alleviate, symptoms of moderate depression and anxiety, mild to moderate depression and anxiety. So it's an essential component of treatment.
Great, thank you so much. We are now at time. We have a number of questions that we weren't able to get to. So Physical Activity Alliance will chat and figure out the best way to get this recording out into the world, perhaps accompanied by a question and answer document that we can ensure that we've been able to answer all of these. Theresa, thank you so much for the employer-employee perspective. Lori, thank you so much for the affordability and accessibility perspective. Mike, to you for the health and fitness industry perspective. Liz from the medical, coupled very nicely with the legal perspective from Amy and Kevin. We truly appreciate this guidance. This is a topic with great interest. And we're grateful for everyone's time. And thank you so much to the audience for tuning in. We will follow up again with the recording and a fact sheet that includes some of the topics that we covered today and a few questions that we weren't able to get to. So thank you all.
Thank you.